Good afternoon. This is Sandy with Sunshine Home and Companion Care. Today I wanted to talk to you a little bit about the seniors of our community, and I wanted to talk a little bit about isolation and depression. We know that when we are accomplishing things and we are doing things in life and we're just tackling our to-do list and tackling all the tasks we have before us, we feel a sense of accomplishment and a sense of worth, and we just feel good about getting these things done. When we are around our friends, when we gather together with our church family, when we gather together with our family, when we are interactive and social with other people, we feel good about that, and that is a good thing. It's so good for us, and it's so good for our spirit, and it's so good for our health to be proactive and to be active and to be out in the community and enjoying life. But let's face it, the seniors of our communities, they don't all have that ability. They don't all have that option. Now, whether they live at home or whether they live in a long-term facility, it doesn't matter where they live. Of course, our goal at Sunshine Home and Companion Care is to keep them at home, aging in place, without going to a facility. But sometimes it happens. So even in the nicest of facilities, in the most put together facilities, they always offer activities and things for them to do. They have calendars just chock full of things for them to do, to keep them engaged, to keep them social, to keep them active. But let's face it, they don't all want to participate. We don't know why. Sometimes they just don't want to participate no matter what is being offered to them. With that being said, it's a catch-22. Like, they don't want to participate yet. They start feeling isolated. They start feeling depressed. They start declining because they feel no self-worth, and they just have really nothing to look forward to. Well, we need to engage with them. If you know of somebody in a facility who needs companionship, we do that. We are an in-home non-medical agency to go into the seniors' homes and take care of them, but we also go out into the community and we will sit and have companionship with the seniors that are in facilities as well. The seniors that live at home, they probably, a lot of times it's because they're not able to drive or they can't drive. They may not have transportation. They may be limited for whatever reason. Again, it is up to us to be able to engage with them and to get them proactive in things that they could be doing to help them feel better about themselves and their self-worth and their accomplishments throughout the day. Now, we know that they've worked their whole lives. Most of them have worked their whole lives in a successful working career. And here they are at retirement, and they all of a sudden have nothing to look forward to as far as accomplishments or as far as socialization. So I went online to seniorcore.com. They have a whole host of information on there. They've shown some statistics on there that I thought are pretty encouraging, and I just wanted to share them with you today. They stated that 84% of the seniors that were polled that volunteer after a 2-year period, 84% state that their health has either remained stable or has improved as a result of their volunteer work. 78% feel less depressed after that same 2 years of volunteer work. They feel less depressed and they feel more motivated. And this one is really awesome. 88% said that that the lack of companionship brings about feelings of isolation, which leads to depression. But 88% of those that are participating with companionship care, 88% show an increase in their emotional state. They don't feel as depressed. They don't feel as isolated. They have something to look forward to, or someone to look forward to come in and spend time with them. There are so many things out there that we could be doing with our seniors. There are groups out there. They have Adopt a Grandparent, and for kids in need, they have Meals on Wheels, where they sometimes can volunteer their time, and so many other things. But I'm coming to you today to let you know that is what we do. That is what we offer. Not only do we go into the home and take care of our seniors and their households and them, but we also take care of their socialization needs. We interact with them. We have so much to offer, and we believe wholeheartedly in companionship and companion care for each and every one of them. Let's face it, none of us like to feel alone. Do we like to be alone sometimes? Well, yeah. But in the long scheme of things, nobody wants to be alone all the time. Nobody wants to have a day in and day out with nothing to look forward to. So if you know of somebody in need, just give us a call at 863-944-3349. We would be happy to come and talk to them. We would happy to become companions with your loved ones while you're working and taking care of your life and doing business. We could be going in and taking care of them during the day or even in the evening. So just don't forget, we do go into the senior facilities, nursing home facilities, and we do provide companionship there as well. Even though they have activities there and they have their CNAs and their nurses, let's face it, that's not companionship. That's 5 minutes of medication and then a few minutes of personal care. So let's get together and put a plan in place, and let's take care of these seniors. Let's get them engaged and let's get them involved and let's get them going. Have a wonderful day. Bye.